So the topic today is vision and learning. And like I said, I'm Dr. Valerie Fraser. I'm board certified in optometric vision therapy and vision development. Our office here is in Wanakee, but we also have a satellite office in Waukesha, Wisconsin. I'm going to start out with a video. And I'm going to ask you this question. Could this child have a vision problem that affects learning? So I'm going to show this video. So I don't think the audio of the shows up very well with this, but basically he's just being asked to follow the ball with his eyes. I just want you to make note of how easy or difficult, any other observations you might make about how well he does with that task. So now we're just covering one eye. So the eye with the kind of frosted thing is now covered. There's really only using one eye for this task. Okay, so one of the things I like to always talk about before I get into vision and learning is the question that comes up is, could it be vision? Because a lot of people go for vision screenings, I've had my eyes checked. I've had my eyes checked several times, or my child's eyes several times. Nobody ever said anything. But we're going to talk a little bit about why the exam that I do in my clinic is a little bit different than maybe what some other eye doctors would test for. So could it be vision? So first of all, let's just talk about how many kids kind of might have these problems. And the research shows about 20 to 25% of children have vision problems that can affect learning. If you take those patients that are having more trouble with reading or learning, it goes way up. So 73% exhibit binocular problems and or perceptual visual processing problems. And we'll talk about what that is, the IT mean and visual processing means a later bit as we go on here. So let's first talk about what is good vision, because a lot of people, when you say, well, what is good vision, most people think about 20/20 eyesight. But there are other visual skills, as our patient in the beginning video just kind of showed, that are needed for reading and learning that aren't measured by the visual acuity or 20/20. So when we think about 20/20, all that means is that you can see a certain size letter at a certain distance. So in this case, 20 feet. The 20/20 line is shown, the line right above the red line on the screen there for the standard kind of eye chart. It's primarily a distance measurement, although it has kind of been transposed into a near card as well. And it's what most people can see, the size of letter that most people can see at 20 feet. That's what it tells you. No more, no less. Doesn't tell you if they have a prescription for distance, although if you're nearsighted, which means that you have myopia or trouble seeing far away, you might have reduced vision, distance vision. Now, the interesting thing is that most good readers tend to be more nearsighted than the general population. So if nearsightedness was associated with reading problems, I think we would know that by now. But it's not. So nearsightedness in and of itself, which most distance vision screenings are testing and many eye exams test, do not tell you anything about how they might perform with reading as far as their other visual skills go. In fact, most of my patients have 20/20 vision without glasses. So what visual skills are important for learning? So here are the few things that we're going to talk about today. So we're going to talk about eye teaming, it's also sometimes called binocular vision, meaning two-eyed vision, convergence, divergence. We're going to talk about eye focusing or accommodation. eye tracking, such as fixation, saccades, and pursuits. And we'll talk about what those are, and visual information processing, or how we process the visual information. So we'll talk a little bit at the end about discrimination, memory, visual closure, spatial relations, and visual motor integration. Now, visual information processing is probably its own talk in and of itself. So we're just going to briefly touch on those areas. Let's start with eye teaming. So what we mean is you have two eyes, they have to create one picture. So the two eyes have to work together. Otherwise, either you're not going to have very good depth perception, or you're not going to have clear and single vision. So there's different types of eye teaming difficulties. So sometimes there's one form of an eye teaming difficulty is an eye alignment issue. Those you can see readily. So if you might be able to see that eye turns in or out or up or down. And that is a more severe form of eye teaming difficulty, and it can affect how learning occurs depending on how the patient adapts to their condition, if it's constant or intermittent. But it doesn't always affect learning, because sometimes the brain just learns to ignore one eye. More commonly are convergence disorders. So those you can't really see when you just look at the person. Their eyes will appear to be straight. Sometimes you can see it a little bit if you bring something really close, but not always. They're more common, but they're also harder to adapt to, even though it's a smaller difficulty. And that's because when the eyes are just a little bit off, they want to work together, so you tend to get more symptoms. And it tends to be more often a near problem, and the symptoms gets worse with the more detailed things are or the smaller things are. So again, eye teaming dysfunction. So you have two eyes. They both have to point. In this case, we're looking at a book at the same place at the same time. Otherwise, things get a little bit blurry or distorted. When you look at near, the eyes come inward towards each other. That's why we call it convergence. When you look far away, they have to straighten. That's called divergence. So some people with these small convergence or eye teaming disorders will converge their eyes too much or not enough. If they converge their eyes too much, it's called convergence insufficiency. Not enough, it's called, too much would be convergence excess. Not enough would be convergence insufficiency. So this is an example of how things can look when the eyes are just a little bit off with one of those convergence problems. Now, oftentimes it doesn't stay like this the whole time. A lot of kids will see, or adults for that matter, will see the words kind of go in and out of focus, or they'll go from double to single to double to single, and it'll actually look like the print starts to move because of that. They also might not get this right away. A lot of times it happens a little bit later once they've been reading for a while. Sometimes the print doesn't get actually double, but again, it can get blurry, look distorted, look kind of like it runs together. I hear that quite often. Sometimes the words overlap. Some common symptoms of eye teaming include sometimes double vision, although it's probably not the most common complaint, especially in my younger children. They might cover or close one eye. Again, if you do see an eye alignment issue, that's a big red flag, such as one eye turning in or out, or up or down. They might try to compensate, though, by just turning or tilting their head to one side. By doing that, they start to use just one eye, rather than trying to use both eyes together. Sometimes you'll see squinting or that closing or covering one eye. And sometimes, again, they will complain of the words floating or running together or jumping around. Sometimes they'll look at something and they'll just be confused and they don't know how to explain what they're seeing. And oftentimes for the kids that do persevere, they'll get headaches, eye strain, eye rubbing, fatigue, especially a lot of fatigue on school days or with reading and near tasks. Some of these kids come home very exhausted. Sometimes behavior problems don't start until they get home. It's like they work so hard all day that they just can't do anything after school. Now, many eye doctors will look for the eye alignment issues I was talking about, those eye turns you can see during a regular eye exam. But a comprehensive exam for eye teaming problems will also include actual measurements of where the eyes want to posture. They'll include looking at the ranges of how much can you increase demand before things go double under convergence or divergence conditions. It'll also look at their ability to switch quickly between convergence and divergence. So that'd be like looking far, looking near, looking far, looking near. That's actually a very good predictor of how quickly the visual system will fatigue. The testing for this also looks to see if they're ignoring an eye or information from one eye. And also in our office, we use eye movement recordings, which I'll go over a little bit later, that look to see how the two eyes are moving together as they read. So next I'm going to talk about eye focusing skills. So the medical term for that is accommodation. But basically, there's a muscle in the eye that moves the lens of the eye. So when you look far away, the muscle in the eye kind of relaxes, and then the lens moves to see clearly at distances. Then when you look up close, the eyes have to do some work. Those muscles have to do some work in order to clear things up close. So in a young child or young adult, this process should be easy and automatic. It develops about 4 months of age. It should be piece of cake, right? Now, as we get older and are more closer to around age 40, then a lot of times adults start needing reading glasses. But that's because we believe that the lens itself becomes harder to move and less flexible. And that's actually what's getting in the way. So it's kind of a different problem than what we see in kids. And the symptoms are a little bit different as well. So adults tend to hold things farther away when they start to have trouble with their focusing system. Kids actually will pull things closer. So again, different problem. Now, symptoms of an eye focusing problem. So if you're having trouble maintaining clear vision up close, you might see a lot of blinking, especially during near tasks. You might see squinting, sometimes when reading, but also sometimes when seeing the board. Because a lot of times what happens is if they're working really hard to clear things up close, a spasm happens and they have trouble kind of relaxing their focus to then see far away. So distance blur, especially in the absence of needing distance glasses, is a big red flag as well. They might avoid close work, as is true with the eye teaming problem as well. They might have trouble with fatigue or eye strain and headaches after or during visual tasks. And they might have signs of like eye rubbing during the near visual activity. Sometimes they complain of the blurriness, like the words might be blurry or going in and out of focus. One thing I always say about that double and blurry vision, a lot of kids don't know what normal is, and so they don't always know how to explain what's going on, or that what they're seeing is not normal. They also might complain of, like I said, the intermittent distance blur because of the focusing spasm. They might hold the reading material very close or move in and out in a rocking pattern while they read. They might also have poor comprehension when they read because of the extra effort that it requires to keep the page clear. So testing for eye focusing problems, most visual screenings don't do any tests to measure eye focusing abilities. The majority of kids with eye focusing problems have no difficulty with their distance visual acuity, although there is that some, if you catch them while they're having a spasm, they will have blurry distance vision as well. One thing that's important to note is that eye focusing abilities cannot be measured once dilation drops go in the eye. If any of you have had that procedure before, you know that that just makes your entire focusing system blurry up close. So if the exam is done after eye drops have been put in, then it really tells you nothing about how the system is working. Most pediatric ophthalmologists or eye surgeons don't test for focusing abilities in children, but some optometrists will. And like I said, most comprehensive visual evaluations won't test that ability to look back and forth between near to far quickly. And again, that is a big factor in predicting eye fatigue. Eye tracking skills. So that's becomes our third visual skill that I'm going to talk about. So one thing before I get into that, though, is to note that if there is eye teaming and eye focusing problems, it most certainly will interfere with eye tracking skills as well. But basically, there are three types of eye tracking difficulties. So fixation is actually the absence of movement. So that's just the ability to sustain your visual attention on an object or hold your eyes still on an object. Saccades are the ability to move the eyes accurately from one point to another. So think about what happens when you read, your eyes go from one word or set of words to the next. Pursuits is the ability to follow accurately a moving object. So that would be more of what happens when we're playing in sports. Interesting, eye tracking is one of the later visual skills to fully develop. It's pretty well developed at age 5, but it really doesn't fully develop until around age 11. Eye tracking ability is an age-normed or developmental process, though, so we can look at and compare patients to other patients the same age and know what we should expect as far as eye movement ability. So some of the symptoms of eye tracking difficulties can include skipping or rereading words or letters, or rereading lines of phrases, mistakes with words that have similar beginnings or endings. They might have to use their finger as a marker when they're reading. Now, beginning readers in the early grades, that might be okay because maybe they're just, not at their full potential yet. But of course, as they get older, they should be able to read without needing that support. Someone with eye tracking dysfunction will also lose their place a lot when they read. They might skip over small words. They might move their head rather than their eyes when they're reading. And they might have some trouble with catching a ball, especially if it's pursuits is where they have a difficulty. I was talking about some standardized tests to assess eye tracking ability. One of those is called the King-Devick eye movement test. That's gotten a lot of press lately because it's now being used as a concussion screener or being recommended for use for screening athletes, so to determine whether or not they've had a concussion. That's because eye movements are the most likely thing to be affected after a concussion. We, in our office, use the developmental eye movement test that's a little bit more appropriate for screening out vision and learning problems. And I'll show you an example of what that looks like. And we also use the Nizuku test of saccades and pursuits, which is basically an age norm test. The readalizer is the eye movement recording I was talking about earlier. I'll show you an example of what that can look like. And then one thing, again, that visual screenings do not do is they don't do any assessment of eye movement ability. So even if you, I know the Lions are doing the program where they have a photo screener where they kind of estimate prescriptions and kind of screen a little bit for those eye alignment issues. Rarely does any visual screening actually assess the ability of the child to perform accurate eye movements. And even most comprehensive exams don't do any sort of qualitative testing to determine if their eye movements are age appropriate level. A lot of times what they're just looking at with eye movements is whether or not the eyes can move in all directions. But again, not really looking at how the qualitative or quantitative abilities of the child to make accurate eye movements. So this is the developmental eye movement test. There's actually 3 parts. This is the final part. The first 2 parts kind of have the child just reading down columns and numbers, and that tells us basically how fast they can read the numbers. If they can't read numbers, then this is an appropriate test for them. This third part assesses more of the ability to make those eye movements required in reading. So the patient would start at the top left-hand corner and read the numbers going across. So 2, 5, 7, 4, 6, 1, 4, 7, 6, 3, so on and so forth till they get to the end of the page. And then they're the results of that are compared against children that are their same age. Excuse me. And it's also compared to how fast they were able to just read down the vertical numbers. So there's kind of the two parts, the how fast you can read, but then comparing the vertical eye movements to the being able to actually keep their place in the horizontal eye movements. So that's all factored in, as well as the number of errors that the child makes. And I say child, but this is age normed up until 18 years of age. So those teenagers would be included in this as well. Most adults can do fairly well. However, adults that have had a long-term vision problem or who have had a brain injury, this test can be kind of helpful in measuring their progress as well. The Visograph is those eye movement recordings that I was talking about. So on the right, you'll see what a normal Visograph reading should look like. So you see there should be a red kind of line and a blue line. The red line is the left eye, the blue line is the right eye, and it's basically measuring what the eyes are doing as they're reading. So the one on the right is what we hope to see, which is a very nice stair-step recording. So the eyes are moving from one set of words to the other, and so just like that typewriter effect, when they get to the end of the line, they're going to go back to the beginning and then go forward again. The other nice thing about the recording on the right is that they're very symmetrical. So you would expect that the right eye and the left eye would be doing the same thing, which they pretty much are in that recording. That one, the one on the right there, is basically after vision therapy. The one on the left represents someone who's having more difficulty, both in eye teaming and eye tracking. So one of the things you might notice right away is that the right eye and the left eye do not look the same. They're not moving together in the same way. The other thing is that this is not a really nice stair step either. So you can tell that they were kind of either taking in really small chunks of information, or sometimes the eyes were going backwards and instead of forwards. So they were losing their place when they read. So that's the three main visual skills of just how we get information into the brain before we even start to process it. So you have to have good eye teaming, good focusing skills, and good tracking skills. Once you get that in, then you have to process the information correctly. So visual perception is all about interpreting what we see. So if you look at this picture here, some of you, if you've seen it before, will know exactly what it is. If you've never seen it before, you might be thinking this looks like something my 2-year-old did while they were playing with ink or something. But if I show you this, you might right away recognize that this is a cow, and the little black parts here outlined are the ears, the eyes, and then a nose. So when you go back to not having that outline of what things are, you should right away be able to see the cow again. In fact, once you kind of see it, it's harder not to see the actual cow. So in both pictures, aside from the outlining of what it is, the pictures are exactly the same, but the difference is we were able to make meaning out of what we were seeing once we were given a little guidance in this case. So that's visual processing in a nutshell. So it's being able to derive meaning from what we see. Now, there's some key areas. I'm not going to go over, there's a lot of other visual processing areas, but I'm not going to go over everything. But there's some key areas that I find that I really look at when I see a child that's struggling in school. So some of these, for instance, the first one, visual discrimination, can be affected by the ability to see details. Memory is remembering what we see. Visualization is being able to fill in the gaps and quickly identify words. That's being able to picture things in your head. So it's also important for comprehension. Spatial relations have to do with directional skills and understanding the concepts of up, down, right, or left. So letter reversals often come from poor directional skills. We start to really understand direction about age 5, and then we fully develop it around age 10, which is why you see change in abilities as far as letter reversals go, typically with younger kids reversing letters and older kids not. And then visual motor integration is the ability to coordinate eyes and hands, and that includes also the gross motor coordination, such as body awareness. Oops. Okay. Symptoms of visual processing difficulties include may confuse similar words or visual discrimination, have difficulty with remembering words on the same page, so memory, confuses minor likenesses and differences, again, visual discrimination, makes errors in copying memory, or has difficulty following verbal instructions. That could be visualization. If you can't visualize the instructions, sometimes it's harder to execute it. Poor printing, handwriting, reversing letters and numbers, ability to remember what is read, goes back to that comprehension piece and visualization. Poor eye-hand coordination, directional, again, skills by confusing right and left directions often. And then poor recall of visually presented tasks. So again, that goes back to the memory. So I went over a lot of symptoms of the different areas, but reality, a lot of what I see when there's a vision and learning problem is more behavioral. So sometimes they don't show all those symptoms because they avoid, they get frustrated, they get angry, they might look like they have an attention problem, they might look like they're lazy, they might just battle, have homework battles, or say a lot of "I can't" before trying. The treatment for the visual skills and processing problems sometimes includes glasses. Sometimes there are glasses that are for eyesight, not that 20/20 part, but sometimes to just help the eye teaming and focusing work better. Modifications and suggestions to improve performance. So basically that would be just adapting the environment to deal with the problem. And then when indicated, vision therapy. Vision therapy services are the most effective at treating convergence, focusing, and eye tracking problems. Optometric vision therapy is what I do, so it's different than what might be, I'll just move forward here, what might be found in some eye clinics, which is generally that they don't specialize in optometric vision therapy. They're doing what's called orthoptics, which is not the same. Sometimes orthoptics uses just computer programs to help treat convergence problems. That was found in the case of at least convergence insufficiency, which is probably the most common thing that I treat, not to be as effective or as effective at all in treating convergence insufficiency. But a lot of you will find some clinics in this area, including UW, using that as a tool to treat convergence deficiency. Unfortunately, the effectiveness rate is not that much better than placebo compared to optometric vision therapy, which has a 70 to 80% effectiveness rate for convergence deficiency. I would say it's a little bit higher than that in this clinic. Just because the study that was done was more of a nationwide clinic. So the other thing is that occupational therapists cannot do optometric vision therapy because it also often involves lenses of prisms, which is kind of what I was showing here. We do a lot of things that involve maybe 3D pictures or lenses that switch the focusing system or switch the convergence system and what they have to do. And again, we were talking about the effectiveness rate. Most Vision therapy programs are going to be somewhere between 12 to 36 sessions. The majority of them are around 24 visits. Ways you can reduce visual stress. So one thing I like to do is create a little bit of a slant board. You know, when we hold a book, we naturally tend to incline it a little bit at a little bit of an angle. That can often help reduce some of the visual stress on the eyes. Try to keep the material elbow to knuckle distance away from the page. Try to find a comfortable chair that allows the patient to be grounded. So by that I mean their feet flat on the floor, or sometimes like a bean bag chair type chair can be really good, or sitting on a couch or something like that that keeps them well supported, or the floor for that matter. The print size can make a difference. Oftentimes kids who are doing well but then have trouble transitioning to chapter books, it has to do with the print size. Sometimes increasing the spacing on the page can help, and decreasing the amount of information on the page can be a big help. So if you get a worksheet like this that has a lot of information on the page, it's going to be harder for the child to make sense of it. So I try to take like a note card or something like that to reduce how much is being seen. Take time away from near point tasks and do more gross motor things can be helpful. Taking breaks as needed, and reducing screen time to just 2 hours a day. Even though kids with vision problems like this can oftentimes play on an iPad or something like that for a long period of time, it's usually because they start to ignore or suppress one eye rather than using both eyes together. So I really try to limit the handheld games to like 30 minutes or less per day. Okay. It looks like we only have a couple minutes left in our meeting time. If you wanted to check out more information, if you're not in Wisconsin, you can go to covd.org. You can also check out our website. There's some links there. If you have any questions, you can also email us or call us, and we'd be happy to help. I am going to unmute everybody and just take a few questions if you have any. Okay, so we should all be unmuted. Was there anyone that had any questions? I know I kind of went through everything kind of fast, but. Okay, well, I guess doesn't look like anyone has any questions that I can hear. So I'm going to end the meeting. And again, if you want any more information, or if you would like a symptom checklist or something like that, go ahead and email us, and we'd be happy to help you. So again, thanks for joining us, and have a good day.